Okay, let's dive into this. Welcome to today's Explainer, where we're going to take a pretty fascinating journey straight into the human body. Today, we're demystifying one of the absolute most common, yet wildly misunderstood digestive disorders out there. Yep, we're talking about gallstones. We're going to explore their whole incredible journey, starting from these tiny, microscopic, silent crystals all the way to fully formed stones. And ultimately, we'll look at the modern surgical cures that help get our bodies back on track. Here is our roadmap for today. First, we'll officially meet your gallbladder. Then we'll see exactly how gallstones form, cover the symptoms and danger signs, and dive into diagnosis and treatment. Finally, we'll wrap up with recovery and prevention. All right, part 1, meet your gallbladder, focusing on anatomy and physiology. Let's establish what a healthy, peaceful, digestive system looks like before things go awry. And this brilliantly illustrates the medical term we're dealing with, cholelithiasis. I know, it sounds super complex, right? But honestly, it just refers to solid particles forming right inside the gallbladder. What's wild is that these particles are actually made from everyday substances that are supposed to be there. Things normally found in your bile, like cholesterol, bilirubin, and calcium salts. For the rest of this explainer, though, let's just stick to the much simpler term gallstones. To really wrap our heads around gallstones, we have to know the neighborhood they live in, the hepatobiliary system. So think of your liver as this massive manufacturing plant. It is constantly producing bile and detoxifying your blood. The gallbladder, it sits just beneath the liver, and it's basically just a storage tank. Its whole job is to hold and concentrate that bile. Now, picture this. You just ate a big, heavy, fatty meal. Your body desperately needs to break that fat down. So the gallbladder gets the signal, gives a little squeeze, and shoots that stored bile straight into the duodenum, which is the very first part of your small intestine. In this scenario, bile acts exactly like dish soap on a greasy frying pan. It breaks down all those fats so your body can absorb them. When it works, it is an incredibly elegant, highly efficient system. Moving right along to section 2, how gallstones form. This is the inciting incident of our story, the exact moment that delicate chemical balance gets completely thrown off.
Let's see how this builds step by step. It all kicks off with step 1, an imbalance in the bile. Maybe there's way too much cholesterol or just not enough bile salts. In step 2, this imbalance causes tiny, microscopic cholesterol or bilirubin crystals to form. By step 3, these crystals start finding each other, clumping together and enlarging. And boom, step 4 is where we actually get fully developed gallstones. Now, step 5 is kind of fascinating. These stones can just sit there, totally silent, doing absolutely nothing for years. Or they can decide to move and block the bile ducts. If they do block a duct, we slam into step 6. The blockage causes sudden pain, inflammation, or even a serious infection. So we go from a tiny microscopic imbalance to a massive mechanical problem.
Now, not all stones are created equal. The most common culprits are cholesterol stones. These happen when the liver pumps out more cholesterol than the bile can actually dissolve. Then you have pigment stones. These are dark black or brown, and they generally form when your liver makes way too much bilirubin, often because of a blood disorder or an infection. And sometimes you get mixed stones. Ultimately, the root cause is usually traced back to having reduced bile salts or a gallbladder that just isn't emptying completely. It just leaves that bile to sit there, stagnate, and eventually crystallize. In the medical world, doctors often use a classic mnemonic to remember the main risk factors. They call it the 4 Fs: female, 40, fertile, and fat. Statistically speaking, being a woman, being over 40, having been pregnant, or carrying excess weight definitely increases your risk. But please, remember, this is literally just a memory aid for medical students. It is not a strict diagnostic rule. Anyone can get gallstones. Notice the other critical factors here too. Rapid weight loss, genetics, diabetes, and even prolonged fasting can absolutely trigger them. Section 3, symptoms and danger signs. Things are about to get serious, because when those stones decide to move, the situation can escalate incredibly quickly. We really have a silent versus angry motif playing out here. First, we have silent stones. The vast majority of people with gallstones actually fall right into this category. They are completely asymptomatic, zero pain. Doctors usually just keep an eye on these rather than rushing anyone into the operating room. But then we have biliary colic. This is the angry stone. If a stone gets lodged in a duct, you get this sudden, severe, intense cramping pain in the upper right side of your abdomen, usually right after you eat a fatty meal. It can last for hours and brings along extreme nausea and vomiting. The peaceful status quo is gone, and the body is loudly sounding the alarm. So the crucial point is knowing when that alarm means you need a hospital immediately. You have to watch out for these red flag warning signs. We're talking severe, persistent pain that absolutely will not quit, developing a fever with chills, or noticing jaundice, which is a yellowing of your skin or the whites of your eyes. Also, keep an eye out for dark urine or incredibly pale stool, and honestly, any confusion or signs of sepsis. These are definitely not wait-and-see symptoms, guys. These point to a severe blockage or infection that needs life-saving medical care right away. Because if you ignore those emergency warning signs, the stakes get incredibly high. A prolonged blockage can trigger acute cholecystitis, which is severe, painful inflammation of the gallbladder itself. Even worse, it can lead to ascending cholangitis, a life-threatening infection of the actual bile ducts. Or, if the stone happens to block the pancreatic duct, it triggers gallstone pancreatitis. These are highly dangerous, potentially fatal complications. The timeline for getting help here is absolutely critical. Which brings us to Section 4, Diagnosis and Treatment. This is where the heroes of our story arrive: modern medicine, advanced imaging, and highly precise surgical interventions. But obviously, before we can fix a problem, we have to find it. So how exactly do we find a silent stone, or even track down an angry one that's hiding deep in a complex network of bile ducts? We call in the diagnostic heroes. The undisputed first-line absolute gold standard tool is the abdominal ultrasound. It's fast, it's painless, and it uses sound waves to give doctors a clear view of stones sitting right in the gallbladder. Doctors will also run some blood tests to check how the liver is functioning and to spot any signs of infection. If the situation is a bit more complex, they'll bring in MRI technology, specifically something called an MRCP, or a CT scan, to really map out those bile ducts. And then there's the ERCP. This is an incredible endoscopic procedure that not only spots a stone stuck in the common bile duct, but the doctor can actually grab it and pull it right out during the test. Pretty amazing, right? Now, what's really interesting about this is how surgical treatment has evolved over the years. If that gallbladder has to come out, we generally have two paths. The first path, laparoscopic cholecystectomy, is today's absolute gold standard. It's minimally invasive, uses tiny little incisions and a camera, and offers a dramatically shorter recovery time. The second path is open surgery, which involves a much larger incision. These days, that's fairly rare. It's mostly reserved for highly complex cases, severe inflammation, or simply if the surgeon needs better visibility to keep the patient safe. Let's wrap up with Section 5, Recovery and Prevention. How do we empower you to get back on your feet and protect your digestive health for the long haul? Recovery is a very active process. Notice the role of physiotherapy here. Things like using an incentive spirometer to keep your lungs clear, getting up for early walks, and slowly reactivating your core muscles are huge. Nutrition is just as crucial. Right after surgery, you'll want to stick to low-fat meals, slowly and gradually reintroducing healthy fats and fiber back into a balanced diet as your body adjusts. Now, if you still have your gallbladder and just want to prevent stones in the first place, the rules are pretty simple. Maintain a healthy weight, lose weight gradually if you need to, and definitely try to avoid prolonged fasting. Fasting just lets that bile sit around and crystallize. Now, abdominal pain can be honestly terrifying because, well, there are just so many organs in there. Let's synthesize the differences to help ease some of that anxiety. Notice how gallstone pain is specifically in the right upper abdomen, whereas kidney stones are usually felt in the flank or the back. Gallbladder cancer, which is a massive source of worry for a lot of people, is actually quite rare, and it usually presents with chronic, late-stage pain, which is very different from the sudden, sharp attack of a gallstone. And, as we learned earlier, if that gallstone pain comes bundled with a fever, you've crossed over into acute cholecystitis, which is a true medical emergency. Having this mental map is incredibly empowering. Now, if you do end up needing surgery, I have a highly reassuring fact for you. You can absolutely live a completely normal life without a gallbladder. I know it's a huge source of anxiety for patients, but scientifically, remember what we talked about in Section 1? The gallbladder is literally just a storage tank. Without it, your liver doesn't skip a beat. It will just continue to produce all the bile you need, dripping it steadily and directly right into your intestine. Your body is brilliant. It adapts seamlessly. Which brings us to our final takeaway. Gallstones are incredibly common, but with early diagnosis and treatments like laparoscopic surgery, the prognosis is fantastic, and patients quickly return to completely healthy, active lives. Knowing how silent these stones can be before they strike, I want to leave you with this thought. Are you giving your digestive system the active care and balanced nutrition it actually needs to keep everything flowing smoothly? Thanks so much for exploring this with me, and we'll catch you on the next explainer.